You're about to hear something all new to the world of aesthetic medicine. 5 of the country's most credentialed surgeons, each at the top of their specialty, having the honest conversations that shape exceptional results. This is where surgical expertise meets collaborative excellence. This is Aesthetic Authority.
I'm Dr. Ashley Amalfi, board-certified plastic surgeon, and I specialize in breast and body surgery here at the Quatela Center. And we are so excited today. We are going to be discussing the transformation, the psychology of the transformation in plastic surgery.
I'm Heather Lee. I'm one of the facial plastic surgeons here at the Quatela Center for Plastic Surgery. And I think this will be a really great jumping off point because I think we're really lucky to be able to get the trust and the privilege to take care of people. But I always tell people, Ash, that the thing that I'm most proud of is not something beautiful I create, it's how I change how people feel.
And it's surprising, right? Like, I don't know that what people think about plastic surgery, what they see about like on the news and on TV shows and in social media, I don't think you get the feeling behind those transformations from what you see. It feels like it's surface and you look prettier or younger, but we don't spend enough time talking about how it literally changes people.
Yeah, I think it's because the doctor-patient, relationship, we get a sneak peek and like really a divulging of people's insecurities. Yeah. And, it is a very vulnerable time for patients when they come in and talk about something that they are not loving about themselves or something that's always bothered them. I don't know about you, but I find, at least in my facial rejuvenation practice, that it is spurred on by a lot of life changes.
Yeah. I mean, usually, not always, but a lot of times we're seeing people at these major life milestones. I feel like I see a lot of moms who have just had kids and they're sort of ending the chapter of sharing their life, their body with their baby and like taking care of that baby. And then they kind of shift that focus back to themselves, which is amazing, but a very huge transformation. Yeah. And then I see sort of these new generation of menopause makeovers. So these are women who have taken really great care of themselves and their bodies for years and years. And then when those hormones change, they almost lose a little bit of control. And so those are really vulnerable patients because they've been doing all the things and doing literally everything textbook to take care of themselves. And then they hit this point where they need you. And sometimes for them, I feel like it's hard to ask for help.
Yeah, that's interesting because I was just thinking about moms. We're both mothers, and it's easy to kind of take that role and really, just invest everything in it. What are some of the
defines us?
It absolutely does. So, what are some of the things that brings certain mothers in that kind of helps them get to that point that, hey, I'm ready for this, or this is something I really want to do?
I see two kinds. I see the women who call me and they're like, I'm literally pregnant right now with my third and my last. And when is the soonest I can see you? So
I'm walking through the door.
Yeah, there's literally ones who are still breastfeeding but want an appointment anyways. Mm-hmm. And then I think the others are really supported by people around them, whether it's like their spouse and they are kind of complaining about their body to their spouse and the spouse is really supportive. I see people come in with moms and sisters, or a lot of talk about, oh, my girlfriend just did it and I helped take care of her and I watched her go through it and now I feel brave enough to sort of take the first step for myself. So they need mostly they need a lot of support.
I think that's so important. I mean, we support patients here. Everybody in the practice supports our patients, physically, emotionally, all those sorts of, but I think that the support that you have at home to have the permission to do this, to feel accepted for wanting to do something for yourself. I find that in my facial rejuvenation patients, it's typically an older demographic, although that has shifted significantly. Yeah. But you have patients who, new job, lost a job, starting a relationship, ending a major relationship, bringing new people into their family, whether it's grandchildren or weddings. My goodness, weddings. Transformation. Yes. Many wedding transformations. So I think it's something about marking those milestones in your life. To me, I find that some people want a transformation. Yeah. They never liked their jawline, or they never had a chin. They had too many chins, or or they've got
you only need one.
Yeah, or a nose that they just never felt like was part of them.
Yeah.
And then I have probably more patients who find that it's not so much the transformation. Yes, it's this physical kind of emotional journey, but it's like a rediscovery, you know, like when you say like, I know this person that I see in the mirror. And I think that's something that is so powerful. We feel it, and I think it drives us to do what we do. But yeah, that rediscovery and that point where somebody looks in the mirror and they don't know who they see. Or I think the other thing too, it's this cultural thing that maybe they're okay, but the way that the world starts interfacing with themselves is like, you know, somebody yells at them across a parking lot, why are you so angry? You know, that sort of thing. And so I think those are a lot of things that start, you know, we'd like to think everybody can live in their own skin and be comfortable, but the truth of that, that's probably not reality.
And I think it's okay. Like, I think when they come to see us, we give them grace about that. We let them know that, like, it's okay. And it doesn't mean that you're any less or you have any less confidence. But if there's something that bothers you and there's a safe and reasonable way to fix that, imagine the mental clarity that you get when you stop focusing. I usually will tell people, like, imagine if you wake up with a pimple or like your hair is really bad and, you know, it's driving you crazy. You think about that all day. Like, how silly is that as women that we really focus in on these silly little things that bother us? And so if you can fix the thing that women are spending so much time focusing, you show up so much better. You just have clarity for yourself, for your job, for your family, for your spouse. And as plastic surgeons, we get to see that every day. We get to see that shift in people's level of confidence every day. And I wish that the news and the media, you know, saw more than, you know, the giant physical transformation or the small physical transformation, because the psychological one is almost more impressive.
Yeah, I think the other thing too is like a lot of people start kind of going into themselves. I think the avoidance factor, where you avoid taking pictures, being in memories, like just being involved in your life. I think that people kind of cower away for the things that they used to love because of insecurities about how you mentioned women, but you know, we have a very robust male population. And so, you know, when they don't feel their best too, you know, it's amazing. I always talk about just in terms of career paths, we have so many people now that are working into the later years of their life, but they're at the peak of their career. And so they still have a lot of energy, vitality, you know, all these things. And, you know, when they walk through the door, do they portray that? And I think that people struggle with that.
Yeah, I agree.
So there's lots of amazing things that, you know, plastic surgery can offer, but I do think it's not right for everybody, or sometimes it's not the right time for everybody.
Yeah, I think that's true. Honestly, saying no is sometimes the hardest part. I always tell people, like, I'm a surgeon. I love to operate. I want to operate on everyone. Like, that's like so fun for us. I know that's like a weird thing for people to understand, but it is like our passion and it's our joy. And so the hardest thing, I think, is to say no to a patient or not now to a patient. What do you see in your practice? Like, what are the red flags for you that say, let's hold off?
Well, so I think that expectation is a huge part of this. And so I spend a lot of time in my consultations to just sit down and say, hey, what are you looking for? Tell me straight up, like, you know, if you walk out of the OR, what are you looking for? What's going to make you happy? What's going to make you very upset or disappointed?
Ask that too.
Yeah. And so it gives so much clarity. I find that sometimes photographs can be helpful because it gives a way for people to articulate something that they may not have the vernacular or something to be able to tell me. But I think that when you say, I want this, and you are a different person, I struggle with that because I don't know, first of all, is that realistic for you? And is that going to change? You know, is it the next celebrity that you're going to want to change to? So I think that expectation is a huge part of it. The other thing too is I find that with facial plastic surgery, you know, the recovery is the thing that people are most nervous about.
Sure.
Because there's no way to cut it. It just looks a little bit distorted, disfiguring those first couple days, it's a doozy. And so, you know, when somebody says like, oh no, this is going to be a walk in the park and I'm not going to need anybody. And, you know, but I just feel like there's more to this. This is a real surgery. I think there's an expectation because we do a really great job of doing it well and doing it safely, that it's quote easy. And I'm like, well, it's not easy. And there is an investment that you have to make in the time and the recovery.
Yeah. I would say I see a little less unreasonable expectations in my practice because bodies can only be, you know, a version of themselves, a bigger, smaller, you know, perkier, less perky version of yourself. So I don't know that I see as many of like, I want to look like that, but there is sort of an extreme in extremes in size, in proportions, in aesthetics that I think is unsafe. And so sometimes I'll tell patients that, you know, if they bring wish pictures, that's what I call them, and it's just too big or it's going to cause more complications or harm in their body, for instance, for their breasts to be just way out of proportion, then I will tell people I'm not the right surgeon for you. And they might find another surgeon who will do that, but there is just way too many complications and you know, negatives down the line for me to be comfortable doing that. I think patients like look at our before and afters online and on social media. And so I think that they are smart about self-selecting. And I know you and I are both like supernatural aesthetic. Like we want people to look like the best versions of themselves, not someone totally different. And so I think patients do sort of naturally attract themselves.
I agree with that. I definitely agree with that. And I think that the other thing too is it's brought another level of like patient awareness and education for them to be able to see so many photos from so many surgeons. And I think that's in net effect, hopefully helpful. A good thing.
Yeah, I
agree. Yeah. You know, the problem with telling patients that it's not right for them is there's so much, you know, riding in this surgery for some patients, and you can see almost like the disappointment in there. I think that the other thing too is I always tell patients, this is a surgery and we think about your health.
Yes.
And so you're right. When we talk about complication and risk, and when those start getting a little bit out of balance, I think, you know, my goal number one is to educate them on why. For example, like I have a lot of patients who weight is a big deal. And when you talk about weight and facial goals, they sometimes play in with each other. I think that sometimes we're able to educate patients on, we can get you here. These are some of the things that'll do it. And it's really amazing because patients sometimes know they want to have surgery immediately. Sometimes we have to wait a while, you know, sometimes in years. And when you get to that point where you can do it and it's finally happened, it is just so like heartfelt to see how it's worth the wait.
Yeah.
You know?
And it's the right time. The right time, the right place. I think that GLP-1s have really helped my patients because I say no for weight a lot as well, because I want them at an ideal weight, but also one that's reasonable and maintainable. You know, I don't want all my patients to be 100 pounds because that is silly and that is just not the world. But I want them to be at a stable weight so that we can give them the very best result with the body that they have and the body that they, you know, want to continue healthily into the future. Yeah. So I think I've had a lot of really great transformation stories with weight loss meds to get people to their goal, and then their results are so much better and they're just, you know, at peace with where their body is, where their health is. And so sometimes for people, like you said, that weight, the waiting weight, not the physical weight, is just well worth it.
Yeah, absolutely. Even like kicking little habits like smoking that you gotta get right, get healthy, and
it's a fresh start. I usually say like, hey, you're having this major transformative surgery and you're gonna stop smoking, and then this is gonna be your new healthy chapter. This is your best chapter yet. And it makes sense because it is that big transformation. So to kick old habits, to optimize your health, to optimize your blood pressure, to really, you know, see your medical doctor and get all of the health things in line before you elect to undergo elective cosmetic surgery is just going to make your result better and you just healthier.
Yeah, I think one of the things that's also great is when you talk about what surgery can do for you, I've seen so many patients who they take care of their skin better, they eat better, they are like, it can be this really kind of like impetus to really change your life and improve your overall health, not just the aesthetic, like cosmetic side of things, as you say. So let's, if it's okay, I wanted to just switch into like, you know, we talked about how you tell people no and the things that we're looking that may not make you a great candidate, or at least right now. Yeah. What are some things that you're like, girl, person, you're ready. This is the time. This is the time in your life that we should jump on this. What do you find in your patients?
I mean, I want them medically healthy and stabilized, and, you know, seeing a doctor and taking care of themselves. For my moms, I want them logistically a year out from their last pregnancy and 6 months not breastfeeding, which is like a very strict timeline for some people. And for my patients, it's just support for recovery. So, they need to have other people who can take care of their little ones, put them in the car seat, put them in the crib, and they need to have support for all the household things that women are generally the ones doing. Yeah. And they need to have that emotional, psychological support from a loved one, whether it's their spouse or their partner or a sister or a mom or a girlfriend who come over and take care of them, because they do need a lot of care in the beginning, just like, your facial patients in the beginning need a lot of help. And so I ask a lot of questions about the support structure, the team that they have around them. And if it's not where it needs to be, I will give people a lot of advice about how to build a team to support themselves, because I want that patient. I always say you're investing in the surgery, but you need to invest in the recovery as well, because everything doesn't happen in 2 hours, 5 hours in the operating room. It happens in the months that you're sort of following the rules and being compliant and taking care of yourself so you can have the best outcome.
Yeah, I find that when you're ready for facial plastic surgery, when you understand what we're embarking on. And what I mean by that is, the risks, the recovery. I sometimes will show people of like, what does day 1, day 7 look like? Yeah. Because I think that patients are often ready to go back within like a couple weeks, really. Yeah. But everybody's job is different, And so I'll show them like the pictures of what things are looking like during that time course for various procedures. And then when they can look at it and say, that makes sense, this can fit in my life. Yeah. You make a really good point about social support, because it is really hard when I take somebody who is healthy and active and I put them through a surgery that is a physiologic stress, but also a really big emotional, mental stressor, because you're going to look in the mirror, you want to look better, and I'm going to take you back a couple steps before we're able to move forward. And so, you have patients who'll come to me and they say, I thought I knew this, and this is hard for me. And I have other people who will glide right through it. Yeah. So I do find that like kind of trying to understand what are the things that I can do to help support patients so that and prepare them. When I hear that, that they have a better understanding of the journey and that they have made, changes to their lives, whether it's social support, job change, or changes in their work schedule, things like that, that they can accommodate this kind of bumpy ride for those first couple weeks, then I know that they're ready. It is also who is making the decision. Yeah. Because, we like to think everybody walking through is doing it for themselves, but sometimes it's not always the case. There's a lot of external factors. And so I think that just to make sure that it's really for you, like this is really something you want to do. I always say you can undo some things. This is not something I want to undo. This is something we're going to do, and we're going to move forward, and it's going to be a great start of something, next in your life. But, we want to be really sure that this is something you're ready for.
It's a commitment. Yeah. So it definitely has to be a personal commitment so that you can go through the recovery, through the ups and downs, because there always are, and get to the end game because you want to and you're motivated to, and you have realistic expectations about what it looks like at the other end.
Yeah, I think the other thing too is I like to think that we are really instrumental in that, because we are the ones that have seen it hundreds of times
every day.
And our patients are going through it, in that first, like that perspective of, being the one that is experiencing everything firsthand. And I think that, when we're able to guide them and say, hey, this is right, this is wrong, we're going to fix this is okay. Yeah. It really pays to have a surgeon who understands you and who you can talk to. And I think we do a pretty darn good job of that.
I think we do too. I think our patients agree. Let's talk a little bit about social media, because I think, we talked about how it's delivering us a more informed patient. And so I think that's what I really see. People are looking at social media not just for before and afters. Like, they're understanding the whole transformation. These people are filming themselves every day of the journey, whether it's good or bad. And I think that that's maybe a little more real than we've ever gotten. And I see like a lot of social media sort of influencers and even celebrities disclosing their plastic surgery, which is so new, but it's so helpful for our patients. Are you seeing that on your side?
Absolutely. I think the thing about it is I can tell a patient what people tell me.
Yeah.
But when somebody is living it in that moment, it's different.
Yeah.
And if I ask that patient, what was recovery like 2 weeks later, they're going to give me a different answer. There's something about being in the moment, experiencing all the emotions, the feelings, you know, and being able to really honestly tell people about it. I think that is kind of a very new revelation in this whole industry that is, you know, I think overall a good thing.
It's relatable.
Yeah.
It gets the conversation going because it's not just people like alone at night on their laptops Googling, you know, facelift.
Yeah.
They are sort of involved in all aspects of the process. Social media gives them a little behind the scenes. Like they get to know who you are before they show up, and it takes away the fear and the barriers. And honestly, for some of my patients, they cross that line of relatability, and then the guard is down, and then they feel comfortable with me, and then they make the call. And so I think that it's more of like a fluid process of comfort and a little uncovering of some of the fears that they had in the unknown. And so that's why I love it, that behind the scenes allows them to take the next step.
It's all about the trust building that happens. You know, it's not just like I trust you as a physician to take care of me. It's I trust your aesthetic. I trust your decision making. I trust your humanity and empathy that you can help me through this journey. So I think those are all really important things that have made a huge difference in like how patients come find us.
Yeah. You've told me before that you feel like your injectable patients do the same thing. Like they're with you and they start to build and align with your aesthetic.
Yeah, I think because, you know, a lot of patients will tell me kind of what they're looking for, what they're not looking for at first. And then at the end, they're like, just do what you do.
Yeah.
And I think
I love that.
Yeah, I do too, because it really shows that, you know, I've built something with this patient. They trust what I'm able to do, not only like the look, but the safety of it. And I think it also helps them embark on those next steps, which sometimes become surgical, which require, like you say, more commitment on their behalf. So that's the only way that we're going to be able to do this successfully. And I think it also enables them to say, hey, doc, this is what I'm looking for. This is what I'm not looking for. I think it used to be very dogmatic. I can't tell you how many revision patients have had surgery decades ago. They come and say, well, I just let the doctor do what they did. I didn't know what they did. And so now they're like, I didn't really want this, but they said, you know, and I think now people are they're more informed and they're more willing to have a conversation. And maybe it's also, I don't know, maybe because we're women. I like to think that does factor in it with my my female patients. They tell me that to be the case, but I don't think that is necessarily a limitation.
Yeah, I think sometimes it's easier to just embark on that conversation. Maybe we're a little less intimidating. I don't know.
I think it's how we carry ourselves in conversation with our patients. It's kind of like girlfriends hanging out.
But we can engage with guys too, you know, and so I think that trust building helps them, even though maybe they'd be less likely to admit it, that they're like watching along to see that they sort of trust the aesthetic. But I think it's there too. And I also see a lot of men who come in, and maybe this is different in your practice, but they come in to see me because their wives do.
Oh, I was just going to go there. It's totally true.
Because their wives have good outcomes, and then their wives are like, oh, you should start getting Botox in your forehead. And then little by little, you know, then they become liposuction patients. And so the trust building comes from the person they trust. Yeah. Their wife, who does all the research, and then they're like, okay, I'll tag along.
The best is when the men are the most like the loudest raving fans of their partners or their wives. Yeah, because I think that just shows that, you know, they're often scared when they start as a support person, you know, like what does this mean to go undergo surgery for this person that they care deeply about? And it's really fun to see them on the other side, just really rooting for them and also deciding that it might be right for them too.
I love that. Yeah. On day one, sometimes the husbands are the deer in the headlights. They're like, what? You're trusting me with all of this. What do I have to do? What don't I do? What am I looking for? Yeah. And then they kind of come into the care team and then they're a part of it. And so I think that resonates with them, and then they feel that good medical care
I think the men too have switched a little bit, where we used to think of plastic surgery maybe as a little bit more kind of female centric, and I just find that isn't the case anymore.
Yeah.
Whether it's men in all demographics who want like changes to their nose and their eyes and jawlines. I can't tell you how big hairlines. Yeah. So like all of it, you have to remember all the things that we feel that are motivating factors. It's across it's generations, it's across ages and genders and all those sorts of things. So I try to take that into the office with me, to see like, where is this person coming from?
Everyone wants to feel great.
Yeah.
Why not?
I think so too.
So let's bring it back to social media. Do you ever have patients where it kind of, that extreme goes too far and people are coming in saying like, I want to look exactly like this person, or, Dr. Lee, make me look like,
ex-celebrity.
Yeah, whatever Jenner or Kardashian of the week. Yeah. Like, is that something that people are bringing, at least in your space?
I think I do hear that sometimes, but I think my approach to facial plastic surgery has always been, I'm not trying to recreate you. I'm trying to take the best of whatever you have and the beauty that makes you special and unique, and like heighten that to like the nth degree. Like that's kind of what I think plastic surgery does. But I do have some patients who, I feel like, when there's something on your mind and it's there and the voice just gets louder and louder, or you think about it more and more and it just takes up too much mental bandwidth. Yes. I think that when that gets addressed surgically and it's gone, it's like a beautiful thing.
Yes.
But I worry when it starts becoming a little bit like we're switching to another thing and it becomes like a little bit like an obsessive kind of mentality. And then I think about body dysmorphia, which we come across in our subspecialties.
I sometimes talk to people about it, like I'm watching this cycle, and for my patients, it tends to be more of like a symmetry obsession. And so they'll be like micro focused on little things, which are very normal. I mean, breast asymmetry is like the norm. And I always tell patients, God can't make things perfect, and I can't either, but I'm going to try really, really hard. But perfection is impossible. And when I have people who are focused in on some of those perfections, sometimes we have to take a step back. And I do have those conversations where I sit down and I look them in the eye and I say, have you heard of something called body dysmorphic disorder? I think we're crossing the line here where your, focus on perfection is not healthy and also maybe not reasonable. And a lot of times people have external supports or therapists or things like that. And I will, I'm not going to pick up the phone and call their therapist. I think that's, maybe not always appropriate, but I'm going to encourage them to do it. And I'm going to encourage them to learn a little bit more about that and see if it sounds like themselves. And those are hard conversations. No one really loves hearing that.
Yeah.
But what I do find is that they do know about it. Mm-hmm. So there is like an awareness that perhaps this is like a little too much. Mm-hmm. And so you saying that is just, I think appropriate.
Yeah, I think it can also quiet that for them a little bit. They're like, okay, I need to back off this.
I get it.
I get it. I need to. The other thing too is I have patients who have struggled with body dysmorphia. They've received treatment for it, and sometimes we're still able to do things aesthetically on them. I think it just requires a very careful conversation about, what to expect. The other thing too is, you mentioned asymmetry, and I spend a lot of times talking to patients about facial asymmetry. You're talking about breast tissue. Not only, but when you mentioned your example, I think facial asymmetry has to do with so much more than just skin and fat. I mean, you have bony asymmetries. You have some hard substances that are going to be very challenging to change if you want this to be perfect. And I think, we always realize that, there's those studies that show that if you take one half, you flip it, you don't look like the same person.
It's kind of wild.
It is. So it's just like, do you really want that? It's not even you. So I think that, sometimes it just requires a little bit of like conversation. I'll have patients kind of go home and think about things and come back and talk about it and see if, we're really sure about it, or we're really, if it's as big of a deal as they really think it is. We do get some therapy clearances for some of our patients with body dysmorphia. It's not everybody, but I do think just having a conversation with any mental health support person saying, hey, we're going to go through this, and it may trigger a little bit, or this may be a little bit challenging, and just to make sure that they have that.
Well, it's that support network we've been talking about. It's just like one more person on your team to help you through the process if you need it.
Yeah.
So for you, what is like the tipping point that makes patients pick up the phone? Because I think in breast and body and face, it's different. I think like the impulsivity maybe in my space is a little more thoughtful, and that process is a little bit longer for facial plastic surgery.
I do think it is. You know, a person's face, like you don't identify your friends by their arms typically, but you identify them by their face.
Yes.
And so it's like so personal, and it's what we put out there. And so I think that, you know, people take a lot of time to make sure. And I think most of all, they're scared something that they don't want is going to happen, you know,
and
like
then you
bad.
can't hide it.
Yeah, then you can't hide it.
Yeah.
So I think what happens is they just get to a point that they've just had enough. Oftentimes in my space, patients will say, I saw a picture of myself. I didn't even know who that person was.
Wow.
They will say that it's an external comment.
Mm-hmm.
You know, it could be by a stranger, a coworker, a relative, their mother, you know, just like all those kinds of things. But I think the point is, it's not just that. It's something that they've been thinking out, but it's gotten to the point that the external world is interacting with it and noticing it too.
Yeah.
I think that's when patients are like, okay, I'm done.
Yeah.
I think it's also when you've spent enough on, for example, like eye creams and concealers, and you're just like, okay, I just need to get these bags taken care of.
Yeah.
You know,
for my patients, it's Spanx. You know, they're just like sick of like finding the perfect undergarments that hide everything and clothes. Like they want to wear certain clothes and not wear a bra, or, you know, feel comfortable when they're sitting at work and their belly's not hanging over their pants. So it's kind of, I would say maybe a little bit more personal because they're not necessarily talking to others about it, and they're mostly noticing it when they're alone getting in the shower, and they'll say like, I don't even look at myself in the mirror because I know I don't like it and I don't want to see it, and I dread getting dressed, and I change my clothes 100 times because I just don't feel comfortable in their own skin. And then for my patients, they just get fed up with it. And you know, sometimes they're fed up right away and they just make the call, and sometimes they live with that, and then they recognize how much mental energy they're putting into thinking about how unhappy they are about that one thing, and then they pick up the phone and make the first call.
Yeah, I feel like it's internal perception of oneself versus the external reality. And so when they're saying like, I did not know that's what my neck looked like, holy moly, like when did it turn like my mother's?
Yeah.
So yeah, I think when they realize that difference, that delta.
Yeah.
So Ashley, one of the biggest like demographics is men in facial plastic surgery, and I'm sure in general plastic surgery. So tell me what you're noticing in terms of your gender kind of demographic there.
I think, you know, the women are okay with major transformations. They're like, make me look like I did when I was 18, you know, and especially after they've had kids, they're like ready to set the clock back and be like the best version of themselves that they can be. And men want more subtle changes. I think that they're maybe a little less comfortable with major transformations because it is now that male plastic surgery, I think, is really taken off, and it's been maybe a little more taboo or a little less talked about, even though it's happening. And so I think they don't want their friends to notice. Whereas sometimes, you know, a woman will be like, no, if I'm getting breast implants, like, I want everyone to know. Like, I want it to sort of show. And guys are like, no, I just don't want my love handles to hang out of my pants and no one's going to notice. And so I think that the maybe results-driven process is a little bit different. And a little bit of that is what's the psychological motivation behind that. And I think that does differ in women and men for me. How about you?
I think it's the social perception of plastic surgery in the male demographic versus the female.
It's similar.
And I feel like it's almost like it's just lagging a little behind.
Yes.
So, for example, now I have colleagues patients who'll say, yeah, I found out all my guy friends are actually doing a little Botox, you know, and it's like,
but no, they're not talking about it at dinner.
Yeah, they might not be talking about it, you know, when you guys go out to the bar sort of thing. I think the other thing too is they realize that there's some really pretty amazing things that can happen when you, for example, just make the eyes look a little a little more brighter, and when you're able to transform hairlines. I think the other thing too is it's just like hair transplantation is a great example of that, because it used to be just kind of like not aesthetically that great.
Yeah.
And then the other thing too is there was a lot of kind of connotations behind that. But I can't tell you how many patients are just really excited and just feel so invigorated to see like something that looks a little bit more youthful, that frontal presentation is better. I have patients who will wear still like hair pieces and toupees, which work for some people, but when you're liberated from having to wear that and it's just your own natural hair, I just think there's just when people are talking about it, like you mentioned, people that are a little bit more kind of like prominent, whether it's celebrities or, I think that makes it feel more normal. And then when you find out like your buddies and your neighbors doing it, it's just...
So maybe we need to ask the male celebrities to disclose, because like the trend right now is that all the female celebrities are disclosing all the things you do, but the guys are doing stuff too. Of course they are. Yeah. But I do think you're right that like their comfortability with being open about it is lagging. Yeah. But there's hope, like maybe if the women are all, open and honest, that they're going to get there.
Yeah. I think it'll take time. And I do think like the age demographic will also shift that a little bit too.
Yeah. So we talked about all the different kind of people we see every day in the office, like the new consults, what's that's like, the process, the healing process, the recovery. But the most like fulfilling thing I see every day is when people are, at their last follow-up and their results are amazing and they show up for me as different people than the people I met the very first time. They walk in differently. They walk in with confidence. They smile. Like they're so excited when I come in the room to like, look at this. Look at what you did. Look at how I feel. Look at my new clothes. Let me tell you about my job. Let me tell you about the vacation I went on with my family and I took a picture in a bathing suit and I would have normally hidden and never been in that family photo. Or I was at my daughter's wedding. Can I show you what I looked like in my dress? And I felt so comfortable and I wore short sleeves. And I mean, the stories are endless and I get to like fill up with that transformation every day. I'm sure you see.
It's the best part of our job.
It's the best part. Yeah. It fills us up. Yeah.
I think the other thing too is you're right. They come in and they talk to you about something that is like makes them so... It's just so uncomfortable for them to finally get the words out that this bothers them and to see them just flourish. Yeah. I see it in, I have stories of, for example, young patients even. Yeah. They're going off to college. Yeah. They didn't like something. We change a neckline. We do a rhinoplasty, something like that. And then they go to college and the thing that they thought bothered them so much being gone helps them just to live this kind of like amazing next chapter of their lives. I've seen it where it can even motivate patients to lose like major amounts of weight and get healthy and just really take care of the body that they're in. I just think that is really, really amazing. The coolest thing about like the whole transformative part of plastic surgery is it's the part you keep the longest. Yeah. You know what I mean? Yes. I always tell patients, this will last maybe 10 years. Yeah. It'll always be better because you have it, but they always they can embark on like new chapters of their life. They're learning Italian, living in Italy, at 60 and doing these incredible things.
Doors open.
Yeah. And I just think that, something that almost felt like it held them back is released. Yes. It's the coolest thing.
And they just show up differently, like whether it's their job or new opportunities or new hobbies or honestly just their relationships. Like a lot of people say like, I'm so much more comfortable with my husband. Our relationship is better because I feel good about myself. And that's just so important. It also affects the way you show up for your kids. And when you feel good about yourself and you're not devoting all this mental energy to obsessing about these things you don't like or insecurities, that's so much mental space to care for and love everyone around you. And we get to see it every day.
It's self-love. It's self-love that you're feeling and you're recasting out into the world. I just think that is it's so important. And it's so powerful when you see it happening. And it's funny. It's not just me and you that see it. It's everybody when they walk through the practice. Yes. So it's like when I imagine that person walking throughout their life, everybody that they're interfacing is feeling that energy.
Everything is better. I like what you said. It's the part you take with you the longest.
It really is. It really is. And, I sometimes I feel like, really? Did I really do? Like, it meant that much to you? Yeah. But I think it meant that much to you because it starts at the beginning when I ask him, what really bothers you? And when you can hone that down and you can change that. Yeah. I often say I can do a little bit of everything, but if it doesn't bother you, it's not going to mean a darn thing. So it's really coming, to be able to express that to your provider, to your doc, and then for them to take that and run. It's a partnership.
Yeah.
It always is.